Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of ENT is the ENT surgery. This is the continuation of our last lecture in which we talked about some surgical procedures, and in this lecture also we will discuss some other ENT surgical procedures. The procedures we will discuss in today's lecture. In the first section, we will talk about the inferior antrostomy. What are the indications and contraindications of antrostomy? What's the technique of inferior antrostomy? And what are the post-operative care and complications of inferior antrostomy? Then in the next section, we will talk about another procedure known as Caldwell-Luc Operation, indications and technique of this operation and how we can manage the patient after the surgery and what's the post-operative care and what are some complications associated with the procedure. And also we will discuss the present status of Caldwell-Luc Operation. In the third section, we will discuss another very common procedure known as SMR or submucosal resection of nasal septum. Very common procedure performed for the deviated nasal septum or nasal spur. This is the submucosal resection or SMR. What are the indications and contraindications of SMR? What's the anesthesia used? What's the position of the patient? And steps of operation. Then also we will talk about the post-operative care, complications, and the present status. Then in the fourth section, we will talk about another procedure known as septoplasty, which is the repair of the septum. What are the indications and contraindications of septoplasty? What is the anesthesia used? What's the position and technique of this procedure? And again, we will also talk about the post-operative care and complications associated with septoplasty. So in today's lecture, we will discuss 4 different surgical procedures in which we have antrostomy, Caldwell-Luc Operation, SMR, and septoplasty. So keep watching sqadia.com to learn about these ENT surgical procedures.